Hello and welcome to Healthcare Today. In today's show, I'm going to be joined by the clinicians of Crisp Regional Hospice and Palliative Care. They're going to talk to us specifically about the services they provide and the difference in the two of them. My first guest is Mary Purvis, Director of Hospice and Palliative Care. Welcome, Mary.
Thank you for having me.
Mary, I want to start out first by talking about some simple terminology and explain to us, what is hospice?
Hospice is a program that is typically paid for by Medicare or Medicaid, but it is for a patient with a life-limiting illness that their physician believes they have a prognosis of 6 months or less.
Okay, and I would imagine when patients or families first hear this, it's kind of difficult. So I would guess your first step is to go in and kind of start explaining to them what hospice is?
Yes, we send a nurse out to meet with a patient and their family and explain all the services that hospice can provide. A lot of times people are concerned when they hear about hospice because they believe that they're about to die right that moment. So usually we're able to get in there, talk to them, and explain our services, which includes a nurse, a CNA, a chaplain, a social worker, and volunteers. And they're all there to help participate in the patient's plan of care to give them the best quality of life for as long as they live with their diagnosis.
Okay, and I want to talk a little bit about that team. One thing is you do bring a level of experience. So probably I would imagine for many families, this is their first round with a loved one with an end-of-life illness. So how important is that for you to bring that skilled care, to these families?
Well, a lot of families are non-medical, so they don't really know how to help their loved one. So the nurse, being the hospice expert that he or she is able to give them guidance and help lead them along the journey as to what to expect medically. Then as far as the rest of the team, we have the social worker that can help with any social worker needs, whether that be financial, emotional, and then the chaplain that can provide with spiritual assistance.
And then I would imagine families probably concerned, is this covered? So who actually pays for hospice?
So hospice is paid for by Medicare or any private insurance or Medicaid. So there's no cost associated with hospice. It is 100% covered, and what that includes is any of the care needed by the interdisciplinary team, which is the social worker, the chaplain, the CNA, the nurse, medications that are covered by hospice, which is anything related to the patient's diagnosis, any equipment they need, like a hospital bed, overbed table, wheelchair, anything that they need to improve their quality of life. So it covers a variety of things that otherwise these patients and families wouldn't have access to.
Like you said, when you go in and you set up, do you help them assess things they'll need and you help them make those choices?
Yes, when the nurse goes in to meet with the patient and their family, they do an assessment and they gauge what they need, contact the physician and obtain orders for everything they need and get the equipment ordered. It's then delivered to the home wherever that may be.
And I would imagine no one client or patient services is the same, so you can actually customize, and help them find that plan of care that is exactly what they need.
Yes, their plan of care is individualized based on their need and of course based on their diagnosis. So some things may cause pain, like cancer, and then that's a primary focus, is managing their pain, where if they have another diagnosis, that may not be the primary focus. It may be other things like swelling or shortness of breath, and that's what the nurse is there for, is to help manage whatever symptom may be out of control.
Okay, we're going to take a quick break, and when we come back, we'll still be joined by Mary, and she's going to kind of tell us what else we can expect and the help they can provide with loved ones that may be needing hospice. Stay tuned, and we'll be right back.
My name is E.W. Trussell, and my wife was on hospice. When she was seeing the doctor, she asked the doctor to put her on hospice. Not for her, but for me. so that I would have somebody to talk to if there was a problem. And anytime I had a problem, I could call the nurse. I had people to talk to that would give me answers that I could understand. And if there was a problem, things that I could do to help my wife. You know, a lot of times people think that hospice is a bad thing, but hospice is not a bad thing. Hospice is a good thing. It's for your family, it's for you, the patient. I can't say enough about Christian Regional Hospice. I praise them, you know, they're just super great. The staff, the nurses, the doctors, the chaplain, the social worker, they all step out and step beyond what you expect, you know. It's a pleasure to have had Christian Regional Hospice take care of my wife.
Whether you're recovering from an injury, suffering from a chronic condition, or an athlete in need of orthopedic support, Crisp Regional Orthopedics team of physicians, surgeons, and physical therapists have your unique condition in the center of it all, using the latest minimally invasive technology to get you back to a pain-free life. At Crisp Regional Orthopedics, we go farther, so you don't have to.
The anti-reflux surgery is where you take the top part of your stomach and wrap it around the lower esophagus to reestablish that valve so stomach acid cannot reflux back up into your lower esophagus. We can do that robotically, so you have about 4 to 5 small incisions, about 1 centimeter in length, and the results are pretty immediate, and most patients are able to decrease the amount of medications they're on for reflux, if not completely stop them altogether.
Welcome back. Once again, I'm joined with Mary Purvis, Director of Hospice with Crisp Regional. Mary, before we went to break, we were talking a lot about the services that you provide and kind of in that initial stage setup. But I do want to talk a little bit about where does hospice take place, and is that a patient choice?
It is a patient choice. Hospice is wherever the patient is. So working for Crisp Regional, we have a variety of options, whether that be home care, which is where most patients are taken care of, is in their home. Hospice gives that patient the ability to remain in the home with extra support, and then the family is able to provide that care. But we all know that that's not always possible, so we also provide hospice in skilled nursing facilities, so a nursing home. We also are able to provide respite care, which is when a patient's family needs rest, whether it be for a vacation, caregiver burnout, or any of those things. They can go into one of our skilled nursing facilities for 5 nights, and that's completely covered under their Medicare, and stay there while that family member gets the rest they need or is able to go out of town. And then we also provide what they call general inpatient, and that is provided at Crisp Regional Hospital, and that's if a patient has a symptom that is unmanaged, like pain or shortness of breath. We can actually admit the patient to the hospital to get that symptom managed before returning them home to their family.
And Mary, I would imagine that, you know, once you get the family settled and they've made that choice where they're going to receive hospice care, the next important step is them just knowing you're with them 24/7. Is that correct?
Correct. We are a 24-hour-a-day service, so a family member can call our answering service 24 hours a day and a nurse can come out. We do set up routine visits, so they're seen on a regular schedule, and then as any need arises, the nurse can come out and make that visit to take care of whatever need has arisen, like a symptom, a fall, a change in pain. They might have gotten sick, and that's what the nurse is there for. She or he is able to come out and contact the physician and let them know the symptom going on and get it taken care of.
And I want to kind of touch on that for a moment, because that's kind of huge for families. Like you said in the beginning, most families are probably non-medical. They might not even understand how to explain to a physician what's going on, but you being right there to be the liaison and pretty much get instant communication, how important is that for patient care and comfort?
It's very important for patient care because it usually gives us a better outcome. A patient can live longer on hospice than they statistically can without hospice because we provide that care, that additional step to make sure we manage whatever symptom arises. So just because you're on hospice doesn't mean you can't receive treatment for an infection or wound care. We are able to provide those things in the home setting and make sure those symptoms are managed as well.
And I would imagine then the main issue you focus on is keeping everyone comfortable?
Yes, our goal is for comfort care. So we want to manage pain, shortness of breath, anxiety. Those are the biggest things that cause a patient distress. And of course the family, they're not comfortable with things if their loved one is in pain. So we want to be able to ensure that both the patient and the family are comfortable.
Well, it's a special type of care that you provide in Chris Regional, and I know families, you've touched many probably along your way. At some point, it must be kind of rewarding too that you're able to provide these services to these families.
It's definitely a rewarding experience. I've done many things in my career as a nurse, and hospice is definitely where I was supposed to land because it is a true service. I have experienced it with my own family and friends. And once you experience it, you know the great good that a well-managed hospice organization can provide to the patient and the family. It's just that extra layer of support that is so important.
And unfortunately, someone soon may hear this word. What would your advice be to them, like in that initial state?
I would definitely say to be open-minded and listen to the hospice provider, ask all of the questions, because the more information you have, the better your experience is going to be. Because nobody wants to admit that it's time for hospice, but hospice can provide you with so much more care than going back and forth to the doctor when there's nothing else that can be done.
Well, I appreciate that. I certainly appreciate you being here and the services you provide to families.
Thank you.
And stay tuned, we're going to take a quick break. When we come back, we're still going to talk about some extensions of services with Chris Regional.
I recommend doing the procedure with the Da Vinci robot system because it's so much easier on the patient. A lot of the operations, you come in, have the operation done that morning and go home the same day. Back to your routine activities about a week to 2 weeks afterwards, depending on the operation and what your activities are. If you're planning to have an operation, you should consider the Da Vinci operation simply because it gets you back to work faster, gets you back to your activities faster, gets you back to your family faster.
Whether you're recovering from an injury, suffering from a chronic condition, or an athlete in need of orthopedic support, Crisp Regional Orthopedics team of physicians, surgeons, and physical therapists have your unique condition in the center of it all, using the latest minimally invasive technology to get you back to a pain-free life. At Crisp Regional Orthopedics, we go farther, so you don't have to.
At Crisp Regional Aesthetics, their goal is to help you look and feel your best. They offer Botox and fillers, laser hair removal, facials, skincare, BioT, and more. Give the gift of beautiful this Christmas with a gift certificate from Crisp Regional Aesthetics.
Healthcare Today will answer today's medical questions, so you can live a healthier tomorrow. If you'd like more information on Healthcare Today's guests or watch previous shows, visit walb.com/healthcaretoday. If you're a healthcare professional and would like to appear on Healthcare Today, contact Kelly Roberts at 446-4074 or email her at kelly.roberts@walb.com.
Welcome back, and once again I'm joined with Mary Purvis, Director of Hospice and Palliative Care at Chris Regional. Mary, before we went to break, we were talking a lot about hospice care. Now I want to switch gears and let's talk a little bit about palliative care. What is that?
Palliative care is a little different from hospice. So our goal with palliative care is that we help manage a symptom or symptoms related to chronic illnesses. So a patient can still actually be undergoing aggressive treatment like chemotherapy, radiation, seeing multiple specialists, but we're just an added layer of support for both the patient and their family.
Okay, and do they kind of have the same team like a hospice team? What is all, what makes up a palliative care team?
So palliative is a lot different. So we don't offer the 24-hour-a-day nursing service. However, we provide a nurse practitioner that's able to come to the patient's home, wherever that may be, and manage symptoms, review medications, provide a lot of teaching that a physician in an office setting doesn't have the time span to do. We also have a nurse that follows up on their needs, ensures that they get their medications called in, that our palliative nurse practitioner manages. And we also have our medical director for palliative, Dr. Smith. And then we are able to provide social worker and chaplain on an as-needed basis for those palliative patients.
And that kind of goes back to a little bit of what we were talking about earlier in this show about a better patient outcome. How important is it that you mentioned the medication? Because again, maybe sometimes people are going home with things that are new to them.
So we found that it provides a lot more support to families having that added layer of palliative care. They are less likely to require emergency room visits. They're less likely to wind up in a pain crisis because they have the palliative nurse practitioner that is focused on symptom control. So they're able to call our office during the week if they have anything going on and get in touch with our nurse practitioner, Jenny, and she's able to help manage those needs.
Okay, and then again, now let's talk about who pays for palliative care. Is it similar to hospice?
It is similar to hospice in how it's paid. It's paid for by Medicare, Medicaid, and most private insurances. And we also are able to take on patients whether they have the ability to pay or not. It's our goal that we are able to provide this service in our community.
Well, what is the length a patient can be on palliative care?
So there's no length of stay for palliative. It's our goal that we're able to manage your symptoms as long as your symptoms need to be managed. So at some point, you may have cancer and a physician may later on tell you that treatment is no longer what's best for you. And then palliative may not be what you need anymore and you may desire to transition to hospice care. Or your symptoms may improve significantly and you no longer need palliative care. So our goal is just to manage your symptom wherever you are at in your disease process.
And I want to touch on one other thing you mentioned with hospice and palliative care about the spiritual support. How important do you see that with patient care?
We definitely see spiritual support being necessary for the entire plan of care for the patient, because both of those entities take care of all of the needs of the patient, not just the medical needs. And with a life-limiting illness, spiritual needs are very important. They help a patient manage their journey through their life-limiting illness, and they often are able to get that spiritual need met with our chaplain.
And I would imagine he extends his services to family members as well that might be struggling or obviously would be struggling?
He does. He's able to meet with families and help fulfill those needs. And also we are able to follow a patient's family with bereavement with hospice too after a patient passes.
Okay, and that is a wonderful service to provide, because I'm sure many people, I would imagine they've taken care of this patient for years, and it's not only grief of the loss, but also all that one-on-one care they've been given.
Yeah, they have to learn their new normal, and we are able to follow up and follow them for a year after their loved one passes, and it's just that added layer of support to help manage any needs.
And I imagine them having that open communication with you and the team gives them comfort as well.
Yes, it gives a lot of people a lot of comfort to have those people that they can call on in their time of need.
Well, it's definitely a great extension of healthcare, much needed and appreciated, I'm sure, by the families you serve. And stay tuned, we're going to take a quick break. When we come back, we're still going to talk about some extensions of services with Chris Regional.
My name is E.W. Trussell, and my wife was on hospice. When she was seeing the doctor, she asked the doctor to put her on hospice. Not for her, but for me. So that I would have somebody to talk to if there was a problem. And anytime I had a problem, I could call the nurse. I had people to talk to that would give me answers that I could understand. And if there was a problem, things that I could do to help my wife. You know, a lot of times people think that hospice is a bad thing, but hospice is not a bad thing. Hospice is a good thing. It's for your family, it's for you, the patient. I can't say enough about Chris Regional Hospice. I praise them, you know, they're just super great. The staff, the nurses, the doctors, the chaplain, the social worker, they all step out and step beyond what you expect, you know. It's a pleasure to have had Chris Regional Hospice take care of my wife.
So at Chris Regional, we have been doing robotic surgery here since 2017, and it is wonderful. Our team loves working with it, and we pride ourselves at Chris Regional on offering safe surgery, but convenient surgery. Most time we're able to schedule your surgery in about 2 to 3 weeks from when we see you in the office. So we really pride ourselves on being able to give that convenience to our community and our neighbors and our patients in a safe manner.
I am now joined with Jenny Tejeda, nurse practitioner with Chris Regional. Welcome, Jenny.
Thank you.
Jenny, this is obviously a profession, you know, that some people may find themselves in or feel drawn to. What is it about this type of care that you enjoy?
Focusing on symptom management for people that are, you know, facing chronic illnesses is important. With palliative care, we add that extra layer of care so that they do have more support with the focus of managing those symptoms while they're still seeking aggressive treatment.
And I would imagine, because some people may not understand even what that layer of care is, when someone's chronically ill, just if, you know, they feel like they might, you know, their color might not look right, or, you know, they might think they're, you know, not breathing as well. Just the comfort of having y'all come and check them out, that has to give family that sense of security, having someone on call with them.
Yes, and families are usually pretty thankful for the additional care, just to know that they have someone that they can reach out to, someone that can offer them that support.
And is that something common? I mean, when you first sit down with families, is that what you give them, the sense of security of knowing that you're just a phone call away?
That is definitely our goal. Our goal is for them to know that regardless of what's going on, we're just a phone call away. We'll be glad to help at any time.
And then what is your favorite part about nursing, just in general, and being a nurse practitioner?
Getting to spend time with the families, supporting them in their time of need.
And is there any advice you give? Because unfortunately, someone's going to hear those words, hospice or palliative care. What would be some advice you'd give them?
Some advice would be, you know, just take a second to let us explain our services. It is very beneficial. We do offer a lot of care And we do offer a lot of support, and support is definitely needed when you're facing a chronic illness.
Well, I certainly appreciate the services you provide to the communities and families, and I appreciate you being here with us today on Healthcare Today.
Thank you for having me.
I want to thank my guests for joining me here today, and also for all the services they provide and comfort to families in our community. We'll see you next time here on Healthcare Today.
I've been doing the Da Vinci robot operations for about the last 7 or 8 years. We have the Da Vinci Xi robot here now. We can do things through smaller incisions, have them closer together. We can place them just about anywhere on the abdomen so we can make the scars not so visible. You know, your risk of post-operative complications is a lot less. Your recovery time is a lot less. With an open operation, you're looking at 6 weeks. Da Vinci operation, 2 weeks.
My name is E.W. Trussell, and my wife was on hospice. When she was seeing the doctor, she asked the doctor to put her on hospice. Not for her, but for me. So that I would have somebody to talk to if there was a problem. And any time I had a problem, I could call the nurse. I had people to talk to that would give me answers that I could understand. And if there was a problem, things that I could do to help my wife. You know, a lot of times people think that hospice is a bad thing, but hospice is not a bad thing. Hospice is a good thing. It's for your family, it's for you, the patient. I can't say enough about Chris Regional Hospice. I praise them, you know, they're just super great. The staff, the nurses, the doctors, the chaplain, the social worker, they all step out and step beyond what you expect, you know. It's a pleasure to have had Chris Regional Hospice take care of my wife.
At Chris Regional Aesthetics, their goal is to help you look and feel your best. They offer Botox and fillers, laser hair removal, facials, skincare, BioT, and more. Give the gift of beautiful this Christmas with a gift certificate from Chris Regional Aesthetics.
If you'd like more information on Healthcare Today's guests or watch previous shows, visit walb.com/healthcaretoday. If you're a healthcare professional and would like to appear on Healthcare Today, contact Kelly Roberts at 446-4074 or email her at kelly.roberts@walb.com.